everyone. Welcome to another episode of Let's Talk About Sickle Cell, the Sickle Cell podcast straight out of the UK, raising awareness for sickle cell and discussing the ongoing issues that we have to deal with every single day. I'm your host, Janika Leah, and I'm also here with hematology nurse practitioner Maya Bloomberg. Hey, Maya.
Hey, guys.
How are you today?
I'm lovely. I'm excited for our hot topic.
I know. So this week's hot topic is hydroxycarbamide, also known as hydroxyurea. Now, we've mentioned this in a couple of our previous episodes on different topics, but I think it's just so important because it's a pivotal treatment that is used for sickle cell. It was originally developed as an anti-cancer drug, but it was found to be effective to treat sickle cell. So it significantly reduces the frequency and severity of painful sickle cell crises. It also reduces the likeliness of having acute chest syndrome, and it also reduces the need for having blood transfusions, even though people can take both. But despite the clear benefits of hydroxy, it remains very, very underutilized across the world. It's severely underutilized in the UK. Like, we have thousands of patients and maybe around only 2,000 to 3,000 of people are actually on hydroxycarbamide. What are the stats in the US, Maya?
Yeah, in the United States, it's the same thing. Despite we have having so much evidence to recommend its use, there was a report that showed only 56% of individuals who should be on hydroxyurea based on the NHLBI guidelines on sickle cell, those indications, were on it. So the 44% who were not on hydroxyurea, which was concerning to me, 41% stated their doctors didn't even recommend it to them. So I think it's being underprescribed because maybe lack of awareness of the providers, of the improvements and just all of the benefits that it can provide, but there's also a lot of hesitation and fear on the patient side. So I think it's going to be a great opportunity to dive into it because everyone knows I love hydroxyurea. I think it's a standard of care, but you have a unique perspective, being more of a holistic approach kind of gal. So I think this will be a very robust conversation today to kind of dispel some of those myths and misconceptions about hydroxyurea.
Definitely. I think it's going to be interesting because I don't know if most of you would probably know by now. I am very much on a holistic journey. So I've been, up until I was about 30, I was very much taking medication and doing everything that was prescribed to me by my doctor. So I have experienced taking hydroxy, and I don't take any treatments at all. So it's going to be a very interesting episode, and also I think a very unbiased episode for us to share this information with everyone, because we're literally like two opposites. I'm a patient, you're a professional, you love it, and I'm all for this holistic journey. So I think an interesting way to do this, because we got so many questions on the Instagram polls, and a lot of them were very similar, and I'm sure you would have had questions. You've done a lot of videos and reels and stuff on this particular treatment. I think a great way to do this would be if we kind of hypothetically, I love these hypothetical things. Last time I was hypothetically pregnant. This time I think that we should do it like a patient professional, hospital visit, and let me just ask you the questions that I guess I want to know and the community want to know, and you can answer, as if you're guiding me and giving me the best advice.
Let's do it. I love that.
Okay, so I guess my first question is, I've heard so many things about hydroxy. I've heard the benefits. I've also heard the serious side effects as well. So to start at the beginning, how does it actually work? Like, what does it do and how will it help me? I have sickle cell SS. So yeah.
Sure. So hydroxyurea, you mentioned, was first created as a cancer drug, a chemo agent, because it slows down DNA synthesis. But they found that it increased the production of fetal hemoglobin. This is what babies are born with. This is the primary hemoglobin produced in the womb because it binds oxygen so strongly. And you need that because that's what makes sure that the nutrients are going to the fetus and they're growing. But from a sickle cell standpoint, we know that fetal hemoglobin offers protection, where the higher percentage of fetal hemoglobin, the more protection you have from sickle cell complications. So that's why we use hydroxyurea. I mean, we had the one episode on gene editing, and one of the gene technologies is basically trying to turn this mutation back on in order to allow a person to produce fetal hemoglobin as that curative approach towards sickle cell. But we have hydroxyurea that can do the same thing as well. So yes, it was initially a chemo drug, but it's not really used for cancer at all. Like all of those initial indications that it was for when it was created isn't even for that. We have better treatment options. So it really is indicated for sickle cell now, and also a condition polycythemia vera, where you're overproducing your cells as well. So we're slowing down the production, but it's also the fetal hemoglobin production that's produced as a result, which offers the protection for sickle cell. You mentioned in the beginning, this helps reduce the frequency of hospitalizations. It helps reduce pain. It improves your hemoglobin level, thus reducing your need for blood transfusions. And the big one is it reduces your risk of acute chest syndrome, which we know is the number one cause of death in sickle cell patients. And just one bad case of acute chest syndrome is a reason to start on hydroxyurea. But I think the fact that it wasn't created specifically for sickle cell, it was initially created as a chemo drug, is what deters a lot of patients. That being said, though, we've been studying hydroxyurea since the 80s. We've been using it for sickle cell since the early 90s. It was in 2003 when we had enough data to say that this medication reduces mortality, meaning this medication makes you live longer. And because of that, we literally put babies on it. We know that fetal hemoglobin production turns off around 6 to 12 months of age, which is when you can start seeing sickle cell related issues. And we literally are putting babies on it between 6 to 9 months of age because the benefits are just so overwhelming compared to the relative risks. Now, I'm not minimizing those risks, and I'm sure we will dive into all of those with your questions, but the benefits are so strong for hydroxyurea that this is why it's the standard of care for individuals with hemoglobin SS and S beta thal 0 for sure.
So, okay, so you mentioned that, it's now being offered to children because it can reduce, well, it literally reduces most of the severe complications and also, reduces our mortality. It makes us live longer.
And protects your organs.
Well, exactly. So is this a long-term drug? So if, I was have to started this from when I was a baby, is this something that you're saying is recommended for me to take for the rest of my life?
So I tell my patients I do not think this is a lifelong drug. We have the first gene therapies that have been approved, which again, it's the first. And I think for being the first ones approved, the results are pretty encouraging. And I think it's really going to transform the care for sickle cell. We have a lot of other treatments in the pipeline that are going to be oral options, IV options that are focusing on improving pain and the anemia as well. So I don't think hydroxyurea is necessarily a lifelong, but I think right now on December 29th, when we're recording this 2023, I think that this is the best treatment option that we have available because it's the one that really is going to protect you and allow you to lead a long life, and not just a long life, but a good quality life. Because our goal is to have you healthy, not have a lot of complications. So once we have a cure available for you and we can get rid of that sickle cell, we're not dealing with all of the subsequent issues. So I think right now hydroxyurea is the best treatment options, but I don't preface it as a lifelong treatment because we're seeing all of the science and advancements in technologies and things that are happening in the pipelines that right now this is the best, but that doesn't mean it's going to change.
Okay, so it's not necessarily lifelong. Now, I know that you mentioned it's really good at, specifically acute chest syndrome. So although I'm now, which on a holistic journey, I don't take anything. I actually was on Hydroxy for a number of years. And the reason why I started it initially was because I had 2 serious episodes of acute chest syndrome. One, which I talk about, I think for the lots of people that have kind of followed my journey and my story, which I share quite a lot. There was one instance where I actually nearly died. My parents were told that I've got a 50-50 chance of surviving, and they told my family to come to the hospital. Like, that was it. I was out of it for most of that experience, and it was the first time I'd ever had acute chest syndrome. I'd never even heard of it before. I didn't know what it was, but essentially my lungs collapsed, and I had to be resuscitated. It was a really serious event.
Yeah.
And then following that, my doctor said, you need to go on Hydroxy. This is in 2006, by the way. So I guess in the UK, it was approved kind of late 90s. So it was still very early days. There wasn't a lot of research. It was still very new. But it was something that initially, with it being new and there not being a lot around it, I didn't want to take anything. I guess looking back, I've always been this kind of person that even though I have sickle cell, I just don't want any medical intervention or as little as possible. So I said that I didn't want to take it. And my doctor said, look, let's see what happens. But usually if you've had acute chest syndrome in the past, I'd also prior to that had a stroke as well. And I wasn't on transfusions anymore. So we waited.
Was it an incidental finding or you had an overt stroke?
No,
I mean, overt is when you have the obvious signs and symptoms. Silence is when it's kind of incidentally picked up if you had imaging for a headache, for example.
No, so it wasn't silent. It was like an incidental finding. So my mum just noticed that I was very strange. I started to mention that I felt unwell before kind of having the stroke. So whilst we were in hospital, I mean, it did take a couple of months to actually diagnose what specifically had happened. But they knew very much that was what happened. And it was reported that I'd had a few silent ones before that major one as well. So I was put on transfusions. Then I stopped them, my choice. Yeah. I didn't want to take Hydroxy, but unfortunately I had another 2 occasions of acute chest syndrome. This time because I knew the signs and symptoms, I admitted myself into hospital, told my doctor it feels exactly the same. So we got ahead of it and I had to have manual blood exchanges at that time. So it was a really horrible process, hated it. And I decided to take Hydroxy. I was on it. So I started when I was about 16 and I came off it when I was around 22 because I was starting to think about starting a family and having children, etc. And it was recommended that I came off it before even, starting for a family, which we mentioned during pregnancy.
Were you actively trying at the time or you thought you wanted to have kids at the time and then that your doctor had recommended, just out of curiosity?
We were planning. So I'm a planner. So I thought, okay, I'm 22 now. If I come off Hydroxy, I wanted to know what would happen if I stopped it. I didn't just want to try and kind of keep taking it up until the point that I got pregnant because I didn't want to stop it suddenly and something was to happen. I also am a very strong believer in I don't like forever. So the fact that I was taking it and it was just like, hey, it's working, let's just see what happens. I wanted to stop it and make sure that I would be okay before getting pregnant. So I initially, mine and my partner at the time, our plan was 25. So I stopped around 22, 23 and kind of monitored what the results were ahead of that. That relationship ended, unfortunately.
I said life happens. But during the 6 years that you were on it, what was life like? Were you getting sick?
I must say it really helped. So my triggers for acute chest syndrome, the very first one was pneumonia. I wasn't up to date with my vaccines. So I would, recommend to everyone that has sickle cell, particularly the pneumovax is very important. If you're in the UK, you're supposed to have it every, I don't know if it's 3 to 5 years. I think it's every 3 years or 5 years, but stay up to date with your pneumovax injection. So I was like 2 years overdue with my pneumonia vaccine. So I caught a cold and then ended up catching pneumonia, and that's what made it really severe. But another thing that I noticed was anytime I traveled or got a cold, like a chest infection, it would turn into ACS. It would turn into acute chest syndrome. So the 2 times following the serious event, it was because the one time I traveled and then when I got back, I ended up having acute chest. The 3rd time I had a cold and then it turned into a really bad chest infection and then I ended up having ACS. So I had no other instances of really bad chest infections. I had little to no hospital admissions, like my crisis were severely reduced. I would definitely say improved my health and my quality of life at that time.
So now fast forward. So you stopped it because you were family planning and you started your whole holistic journey. So how has sickle cell life been with no treatment?
Well, no Hydroxy. I was diagnosed with a vascular necrosis I would say probably 2 years after starting Hydroxy. So that was probably something that was inevitably going to happen anyway. So I would say that I've had a lot more severe complications. So I stopped my Hydroxy at 23. And between 23 and 25, my AVN really developed in my hips. I was on a lot of pain medications. I had more, I would call them manageable crises. So crises that don't necessarily require me to be admitted into hospital, but I had that chronic pain. And I also would have, regular crises that I could manage at home with some opioids. But you know, they became more, I would say. They definitely increased in amount. Now, however, I focus more on my diet and what I'm intaking and what I'm doing. I drink less alcohol. I try and have more herbal teas and stuff. I'm doing okay. So outwardly, I would say now I'm a lot better than I was. I rarely have a crisis. I go about 3 to 4 years. So far, it's been 3 years. That the longest I've gone is 3 years without having a crisis, and I'm not taking anything. However, I'm aware of the internal damage that is happening. So my sickle levels are about 96%. My HB is generally low 7, so 7.4, 7.5, and it doesn't really get, the highest it will go is like about 7.8. So with that in mind, I am aware that I'm on this holistic journey, but I'm also aware that this is not a permanent treatment. And as I get older, I've had so many complications. There will definitely be long-term damage that is happening, and if I want to live longer, I'm gonna have to take some kind of treatment. Like, I'm not in doubt of that. I think I'm just in this phase of enjoying the time that I have while I
But
can.
honestly, everything you're doing now is great because there's no amount of medication that will ever outcompete a bad lifestyle. Like, even if you were to take hydroxyurea and have a terrible lifestyle, like, you could be doing clinically better off of hydroxyurea with your lifestyle than somebody on hydroxyurea. So I think everything you're doing from a lifestyle standpoint is so important with regards to having a balanced diet, feeding yourself with fresh fruits and vegetables that can just like nourish your body and your immune system, and getting good quality sleep. And I mean, we always say avoid alcohol, but I understand people are going to drink it.
I've
So
limited
I would
it. I've
limit, if
limited
you are going to drink
it.
alcohol, just make sure you alternate with water, since we know it's super
Drink water in
dehydrating. And
between.
I mean, I got latent TB on a mission trip I went on. So I had to go on treatment for 9 months and I couldn't drink alcohol at all. And I realized there's just such a social aspect with drinking that I just had a club soda with a lime holding in my hand, because then it would get people to stop asking me why I'm not drinking. So just consider that if you're a social drinker from that standpoint. Um, but back to hydroxyurea, like you said, even if you're not having significant hospitalizations and pain crises, there's still sickling that's going on internally. So when I'm thinking about patients and when I'm going to start hydroxyurea, I'm all about shared decision making, because at the end of the day, I can prescribe you something, but it's not like I'm force feeding you medicine down your mouth and that it's going to make a difference. So I totally have a conversation with my patients, because everyone should view their healthcare provider and patient relationship as a partnership. It shouldn't be a paternalistic, one-sided flow of conversation. It needs to be a two-way flow, because not everybody's the same and everyone has different treatment goals. So if you were my patient and I'm listening to what you're saying, I would recommend hydroxyurea because you have history of stroke, and hydroxyurea helps prevent against that. You've had really bad cases of acute chest. Just that one bad case I mentioned would be a reason to start hydroxyurea. But again, if you don't want to do it, I would then educate you on other signs and symptoms that would then make me want to start it more. And then we can also clump this together with other genotypes, because when we look at the sickle cell guidelines, hemoglobin SS, standard of care is to be on hydroxyurea. Sickle beta thal 0, also standard of care because it's very clinically similar. Now, hemoglobin SC, it's not as clear cut for when you would start somebody on it. So I kind of put hemoglobin SC and also my hydroxyurea averse patients who don't want to be on hydroxyurea, but these are also indications that would make me a little bit more pushy to put on some treatment. So say you have hemoglobin SC and you have really advanced sickle cell retinopathy, or it's rapidly progressing. We know sickle cell can affect the eye. So say you have a sickled hemoglobin that just blocks a blood vessel in the eye. We then develop these collateral vessels that kind of form like spider web vessels that are really fragile. They serve no purpose at all. And if they bleed, you can go blind. Hemoglobin SC genotype is the highest risk for this, but it can happen in all genotypes, which is why we recommend the dilated eye exam starting at the age of age 10. But say you have hemoglobin SC and your retinopathy is just advancing really quickly, that could be a reason to start on hydroxyurea. Now, for all of the other genotypes, other reasons to start hydroxyurea, even for people who don't get pain frequently or aren't hospitalized, would be if you do have evidence of organ damage. So if you have evidence of kidney damage, so one of the earliest signs is you're spilling protein in your urine. When I tell my patients, I don't want you to go home and think, oh my God, I have kidney failure. Like, this is just a super, super early sign. And this is why we monitor it, knowing that sickle cell can cause this effect. History of stroke is a big one. Avascular necrosis, we know the higher levels of fetal hemoglobin production, the more protection you have from progression, because with AVN, we can't reverse it, but we can slow the progression down by maintaining a healthy weight, by doing physical therapy, and then by medicines like hydroxyurea. So again, I understand my patients who do want a more holistic approach. So I'm happy now that I have options, because when I first started over 10 years ago, all I had to treat sickle cell was hydroxyurea and blood transfusions, where now in the United States, we do have a couple extra options. I know the UK doesn't have all of them, but we both have crizolizumab, which is a nice option, especially for the hemoglobin SC. But that being said, they might be pulling that drug available from the UK
I
market.
know, I've heard. I mean, they already pulled it from Europe.
I
Is
understand
it Europe?
why, but it's like, I think when you look at the data, the STAND trial, which they were basically doing a phase 3 trial for crizolizumab, looking at the 5 milligram dosage that's already FDA approved, and they looked at 7.5 milligram dosage, and they did it across the entire world. So it wasn't like the United States or the UK. It had people worldwide. It was like 30% of the people in the study were white, just to show you that the demographics of the population of sickle cell, it can affect all races and colors. So one of the limitations when you're doing a big study like that is there can be differences in demographics and how their sickle cell presents. So in this STAND phase 3 clinical trial, it basically showed that crizolizumab didn't make any difference with pain or length of stay in hospitalizations, regardless of the dosage. And that's why they're trying to remove the authorization. But in the United States, I have patients who I do see a clear clinical benefit. Are they having zero pain? No, but they're having less severe pain or less frequent crises, or things that used to trigger a crisis no longer are triggering crises. So I do see the clinical benefit, and I think it will remain available in the United States. But again, we have different options too. So we also have Voxelotor, that's Oxbryta. It's an oral medication that works to make the oxygen stick to the hemoglobin stronger, and by doing that raises the hemoglobin and reduces anemia. And then for my holistic people, we have one that was called Endari, which is really high doses of L-glutamine. That one came out probably 5+ years ago, but that was the first sickle cell approved drug since hydroxyurea in the United States. I know crizolizumab was like the first one that was approved since Hydrea back in 2019 or so for you guys. But Endari is just really high doses of L-glutamine, which is an amino acid. You can get it at the vitamin shop or a GNC. And it has no effect on your hemoglobin, though. So it's not going to reduce the hemolysis or red cell breakdown. And that really is kind of the stimulus of what triggers all of the downstream sequelae that causes organ damage and all of that stuff. But it does show that around 25-30% of people had a reduction in pain. So it's just nice that we are seeing more and more treatment options that we're able to really utilize shared decision making, because hydroxyurea still is my favorite. I think there, again, so many benefits. Like I think the majority of people should be on hydroxyurea if you have SS and SBO. And just thinking how we started this conversation about how underutilized it is, I'm hoping that we can still debunk some of those myths. But it's nice that at least if I have a patient who does not want to be on hydroxyurea, regardless of what I've told you, I still have some other options. So I feel like we're doing something to help manage your sickle cell pain, instead of just letting you kind of carry on with your life, knowing that you're still having some internal damage going on, even if you're not in the hospital every month.
Exactly. Like, I feel like, I hope that the UK gets some more of these, especially like the holistic ones that you mentioned, Endari and so on. But we've gone through like the benefits, and I would say, as someone who has been hydroxy, who has come off it, seen the best sides of both worlds, so to speak, and is now doing okay, but I'm aware of the internal damage. There are a lot of benefits. So from my perspective, I know that for prescribing hydroxy to children that are just months old and making them take it early on in their lives, the reduction in kind of like long-term damage in terms of organ damage, AVN and stuff like that. Speaking as someone who has been through the majority of those complications, I definitely would say that it's something that is really positive, because they are all horrible. Strokes, avascular necrosis, acute chest syndrome, all the frequent crises. And then again, you mentioned, if you're going into your adult years, even if you're not having frequent crises, you also will then have organ damage and all the long-term damage that comes from having high sickle levels.
And age-related risk factors for heart disease, diabetes, etc. So you then have the whole aging component of life compounded with sickle cell to complexify things further.
Exactly. So there's so many benefits, and I would say I can see the benefits. If I was in a position where I wasn't taking any treatments, but I was, feeling a lot of chronic pain, or was having more frequent crises, like, more frequent than like once every 3 years, then I would definitely say it's something that I would consider going on. But a lot of my kind of, I guess, reluctancy is the some of the side effects. And it's all good and well, like we always talk about the benefits. And if you're someone that experiences a lot of these complications, then it seems really, really good. But some of the complications that I experienced when I was on it, which may or may not be important to some people, but the hair thinning or hair loss was definitely something that I experienced. I definitely used to get a lot of bruises. Just like if I bumped my hand just like lightly, not even seriously, it would like bruise severely. The darkening of my nails, I think, started to happen in about the last year, but it wasn't really significant. So those are some of the complications that I experienced, but there are some others that people say, for example, I don't want to take hydroxy because it can cause cancer.
Can we dive into all of these? Like, I just want to break down, like, we should just go one by one with your symptom, and I'm going to give the provider perspective of it. So let's start with hair loss.
Okay, so my hair thinning and my hair loss, like I noticed that significantly.
So this is a rare side effect of hydroxyurea, but that being said, I totally get it. Like, it's a cosmetic issue, but as a woman, I mean, our hair, skin, and nails are very important to us. So I understand how it can be distressing. Interestingly, though, when we look at the data, there was actually no statistical significance in hydroxyurea use with hair loss compared to people without hydroxyurea. But as you mentioned, there can be occasional hair thinning noted, and things that you can consider if this is a problem for you. Pregnancy, I had lovely hair thinning from that. So I take Nutrafol, which is a hair supplement, and when it comes to supplements, I'm always a little weary to recommend them to patients because we know that supplements aren't FDA regulated. There's no clinical trials that say, like, I'm all scientific basis with my medical recommendations. So it's hard for me to recommend supplements, but just personally speaking, Nutrafol really helped with my hair thickness, but you can also consider biotin or even like prenatal pregnancy vitamins gives you all the nutrients to help keep your hair, skin and nails looking good. And you also just want to prevent, like I used to wear my hair in a pulled back ponytail, but any type of tight ponytails and put stress on your hairline, that can lead to more hair thinning. The hyperpigmentation of the nails or the dark lines on the nails, another cosmetic issue. As a provider, I like it because it makes me know that you're taking your hydroxyurea. There's certain things that you can't necessarily hide from me. You can cover it up with nail polish. But again, I think from a provider perspective, I just look at the benefits. So when I think about the cosmetic issues of hair thinning and dark nails, the benefits still outweigh the risk. But at the same time, when I was in high school and all I cared about was my physical appearance and fitting in, etc., I understand why that really would be difficult for somebody to live when you're already trying to figure out who you are with a chronic illness on top, especially one that's so unpredictable where you can be fine 1 second and the next just incapacitated. So I do understand this as the side effects, but again, I still think the benefits are there. With regards to cancer, there's no increased malignancy or cancer in people with sickle cell on hydroxyurea, and this is based on a lot of large observational studies that we're looking at. There's no increased malignancy in people with normal bone marrows taking hydroxyurea for other diagnoses in long-term studies too. So again, hydroxyurea was approved later for sickle cell, but it's been used for decades and decades and decades. So when we look at other diagnoses that are being treated with hydroxyurea, no increased malignancy. There's also been no evidence to suggest that there's an association between hydroxyurea and the development of leukemia or cancer in adults or children, and this is on multiple studies. So I think it's important to validate people's concerns because, yeah, I've heard that it can cause leukemia too. But again, we've been studying this for decades and decades and decades, and you look in all of the clinical trials and what evidence-based writings have been published, and there's like 3 case studies on leukemia. So it's like maybe they had some part of their genetics that could have increased their chance of developing leukemia. And so it's very hard to say with 100% certainty, like, no, it's not hydroxyurea. But from the data and the research that we do have, the science is showing that there really isn't that much data to substantiate a correlation between sickle cell hydroxyurea and cancer or leukemia.
I'm so glad that you covered that because I'm like a research person. I love reading like data, reports, all of these things. And when I heard that, hydroxy causes cancer, I was like, what? Like, I was taking that. How did I not know? Like, I thought like, oh my gosh, I didn't read the side effects. So I did my own research, and again, I found that there was no evidence of this. I feel like one of the reasons that this becomes a common misconception is because of the relation of, hydroxy being a type of chemo drug. And then when we look at kind of some of the other curative treatments that are, available for sickle cell, you like bone marrow transplant, we have all the new gene editing, chemo is obviously a part of those. And there have been some instances and some of the evidence which you've shared that shows that it can, like that aggressive form of chemo can cause that. And I don't know whether people are relating the two, like just the word chemo.
And there's a big difference, though, in the type of chemo used for like hydroxyurea. Even though it is a chemo agent, the mechanism of action is completely different than bisulfan, which is the chemo agent used for gene editing. And then for bone marrow, they use a combination of chemo. So it's very different because, again, it's combinations of therapies or more intense chemo regimens, which then can potentially increase the chance for malignancy. Like I know for Bluebird Bio, they had the 3 SAEs or serious adverse events in their gene therapy trials, and 2 of the individuals developed leukemia. And in my perspective, it makes, and again, they didn't think it was related to the gene therapy itself, but knowing that, I would almost want to check all of my patients' cytogenetics and just like look at your genes and see, do you have any pre-genetic predisposition that could potentially increase your risk for developing leukemia from this type of exposure. So again, I can't wait to have my own hands-on experience with gene therapy, but my plan would be to try to test my patients beforehand to see. That way we can go in more informed, because I think it's very difficult because we all have these hesitancies and reservations and concerns, and we have to trust what the science and the data is showing us. But the beauty of science is that it's always changing. Like we're constantly learning more, but at the same time, it's hard if we're learning more and it ends up being a negative learning piece. So when it comes to leukemia and the chemo used for gene therapy or bone marrow, I think one way to kind of mitigate that would be interesting to see if we can get insurance to cover cytogenetics and whatnot, and try to just look at a person's genetic makeup and see, is there anything that would increase their risk, which could then potentially contribute to, is this a good decision for you to proceed with this type of therapy or treatment option? I think a huge concern that we haven't even touched is fertility, because I feel like you stopped at
Yes, that was going to be my next one.
We're on the same wavelength.
Come on. So, okay, yeah. So first of all, I'm just glad that we can openly and outwardly say on the podcast that it doesn't cause cancer, guys. So if that's what you're hearing, now the fertility issue, I think that, well, not I think, that is a big one. I think a lot of people think that, I think for men specifically, it can cause impotence. For women, you shouldn't take, this is what I've heard. Men, it can cause impotence. Females, you just shouldn't conceive on it and shouldn't take it throughout pregnancy because it can cause issues with the baby and with mom. So can we clear that up?
Yeah. So let's start off and say sickle cell causes so many issues. So before we blame everything on hydroxyurea, sickle cell can reduce your sperm counts for a man. Sickle cell can diminish ovarian reserve. So that's where your eggs are produced in a woman. And it is possible that hydroxyurea can reduce this further. So starting with the men, just because it's easier to kind of break down that misconception. If I have somebody who's doing really well in hydroxyurea and they want to get pregnant, I usually won't stop their hydroxyurea. But say they're actively trying, they're timing it, because we know that when it comes to getting pregnant, there's literally like a 24 to 48 hour window period each month. So if you're not timing it, you're just practicing. So if you're timing it well and you're still not getting pregnant, then my next step is, okay, let's do a sperm analysis. I also think, do you have iron overload? Because iron overload, if it's not addressed, you can have iron deposit on your liver, on your heart, on your brain. And if it deposits on your brain, that can lead to fertility issues for both men and women. Iron overload, if you didn't know, can actually deposit on your joints too and contribute to joint pain. So there's so much importance to actually addressing the iron overload. But for a man, it's important to realize it could potentially do that. So say I get the sperm analysis and it shows that they have 0 sperm. And at that point, I'd be like, okay, maybe we should hold the hydroxyurea for a few months and just see, does this help you get pregnant? But the amount of times I've had to do that compared to the amount of times my male patients just get pregnant on hydroxyurea, it's very, very few. It's usually it's the exception where I'm having to stop the hydroxyurea in order to help somebody optimize getting pregnant. So if a male is having fertility issues, things that you want to consider is are you overheating your boys down there? Because if the testicles overheat, that can lead to sperm abnormalities. So if you're in the sauna or if you run a lot or you just want to make sure you're aerating down there. And you also want to make sure you're not going too long without ejaculating, because once you go beyond 5 days, the health of the sperm reduces, and that can lead to difficulty getting pregnant. So you don't have to do it every single day. Like, I felt bad because I kind of made my husband feel like
Hey
me.
guys, every 5 days.
But it's all about timing. Like, I had a miscarriage and I was super depressed afterwards. That comes around, it's Valentine's Day, and I'm like, how do you not have sex with your husband on Valentine's Day? And it's like, literally was the one time that entire month that I had sex and I got pregnant. So it kind of just shows you really don't have that much control. It's all about timing. You don't have to be a jackrabbit who's just like going all like, but you just want to make sure not
Yeah.
to go the 5 days from that sperm standpoint. Now, for women, not every pregnancy is planned. So you are a planner. You had your life set up for you. You know that you were going to actively start and try to conceive. So in those individuals,
And can I just say, guys, planning doesn't always work because, you can overplan and then nothing
and when it
happens.
comes to getting pregnant, you're talking to another queen planner, control freak over here. You can't
Exactly.
plan pregnancy. And honestly, the sooner you kind of just like go with the flow and surrender and trust the process, it's going to be such a better experience for you, because I'm so glad I don't have to have more kids, because the lack of control is really, really challenging. So if you are planning, we're going to stop the hydroxyurea when you're trying to conceive, but we are all well aware that not every pregnancy is planned. So otherwise, you want to stop as soon as you become pregnant. And I've had people find out that they're pregnant at like 6 months, stop it at the time, and they still have a healthy pregnancy. Interestingly, there are a lot of anecdotal cases of people staying on hydroxyurea during pregnancy, but we talked about that in our pregnancy podcast. So just talking about fertility as it relates to hydroxyurea, there was a report by Dr. Pecker, and I hate that this paper was published, but at the same time, I'm glad it was published, because it was the first one that was kind of highlighting female fertility, ovarian reserve, and hydroxyurea use. The problem is that this paper ultimately concluded that hydroxyurea can potentially negatively impact a woman's fertility potential. But when you look at studies, any type of clinical trial or retrospective study where we're just looking at chart reviews, et cetera, there's going to be some limitations. And in this study, there was no control. So that means that there weren't two groups of subjects being compared. It was just like all women who were on hydroxyurea. So if these people were already taking hydroxyurea, you kind of assume that they had a little bit more severe sickle cell to begin with. So that could have potentially reduced the ovarian reserve altogether. So I think there were some limitations to that study. But again, it is a valid concern for our patients. But Dr. Alex Power Hayes, she made a comment that just resonated with me so much. And it's just, we have to get you to pregnancy. Like, you're so concerned, and people are so concerned about the potential effects it could have on fertility or causing infertility. But our goal as a provider is to get you to that point where you can actually have kids. And hydroxyurea is something that can really help us get you to that point and help prevent the complications and prevent the organ damage. And I think, just from personal experience, I have countless patients with sickle cell who take hydroxyurea, who go on and have a healthy pregnancy, healthy baby, etc. And there was also another, since we're talking about data and we're little data geeks over here, there was a phase 4 study of 101 people with sickle cell on hydroxyurea, and there were 125 pregnancies. So again, right, you can get pregnant on hydroxyurea. In theory, hydroxyurea is protecting all of your organs from sickling and just the damaging effects of sickle cell. So in theory, you would think that hydroxyurea is going to help the ovarian reserve. But when we think about fertility for sickle cell versus an individual without sickle cell, your ovarian reserve is going to become more reduced at an earlier age than mine is, regardless, because of sickle cell. So I think we need to do more research on the topic, and I think we will get more data. I mean, we have Tiana's SC Red, and there's a lot of interest in sickle cell and reproductive and fertility, et cetera. So I think we'll get more and more information. But right now, I think if infertility is a reason deterring you from taking hydroxyurea, I would just say, if you're having any sickle cell complications and organ damage, et cetera, that is more of a priority, because I want to keep you healthy so you can get pregnant. And again, I don't view hydroxyurea necessarily as a lifelong treatment. I just think it's the best treatment we have currently, but it's not something that I promote as like, yeah, you're going to take this the rest of your life.
So what we really need to do is, I guess, stop pointing the finger at hydroxy being the cause of all of the issues sometimes, because we have to look at sickle cell as for it as what it is. And sickle cell in itself can cause impotencies, it can cause infertility, like if it's really bad and if we're having all these chronic complications. So in actual fact, taking hydroxy, therefore reducing all these chronic complications, therefore equaling to maybe being able to have children and do all of these things. Are there any other serious complications that I haven't mentioned? So we touched on, cancer. I touched on the hair, the nails, the skin bruising or sensitivity. Is there anything else I've missed?
A couple of things. So you talked about skin bruising. So just the effects of hydroxyurea on the skin. We know sickle cell ulcers are a complication of sickle cell, but very, very rarely we can see it as a complication of hydroxyurea. Again, we have a clinical trial that shows there was some. Have you heard of a Cochrane review? Where basically it's like a systematic analysis. A Cochrane review is a great place if you want to just look at one particular subject. So you could type into Cochrane review like sickle cell ulcers, hydroxyurea, and it'll just pull every single report that it has. And when they did a Cochrane review, they actually found that there was no increase in leg ulcers on Hydrea versus the placebo. But just knowing it's a potential side effect, you want to always make sure you're looking at your ankles and your skin. Sometimes it'll start off looking like a mosquito bite, and then all of a sudden it opens up and you have this huge wound. You're like, what the hell? Like, where did this come from? So that's one side of effect. You talked about bruising, and I do have some patients who report the same thing as well. And I haven't been able to find a reason why. We know that hydroxyurea potentially can reduce your platelet count. So people who have low platelets, like below 75, you wouldn't really want to be on this type of therapy. And low platelets can increase your bleeding risk. But all my patients who had the easy breathing or maybe had heavy periods or heavier periods since starting hydroxyurea, I haven't been able to really find that correlation. So it's just monitor it. If it becomes more frequent or it worsens or you get new bleeding symptoms, then like for sure, we got to look into that further, but just something to be aware of. The other two things that I think are important are just the lab effects it can cause. We know that there's always side effects. I mean, just over-the-counter Tylenol has side effects, but with hydroxyurea, we know that it can affect your bone marrow, because I talked about the mechanism of action is it slows down your DNA synthesis. So what if it slows it down too much and causes something called bone marrow suppression, where essentially your bone marrow stops producing white cells or hemoglobin or platelet counts. So when we start somebody on hydroxyurea, for the first 3 months, I usually would do monthly labs just to make sure that we're able to pick up any problems before it becomes a problem. Because again, it's not like you start taking it and the next day you're going to have all these issues. It's usually slow and progressive. So we can do our screening tests. We can check our labs to make sure we can see if you're having any undesired side effects. So we'll check your labs. We'll make sure your white cell count, platelets, et cetera, are stable. If there is any evidence of bone marrow suppression, and the big number that we look at is your absolute neutrophil count. There's different providers who have different comfort levels. But when we look at the clinical trials, when people had the same exact fetal hemoglobin production, those who had a lower white cell count did clinically better than those with a higher white cell count. And that's because white cells are really sticky. So when you have your sickled hemoglobin, you have even more white cells to stick onto that, which then worsens the blockage of blood flow and worsens the pain, et cetera.
Was this before starting hydroxy? They had like a lower white cell count?
This was in the clinical trial. So they would look at the people, everyone on hydroxyurea, and they compared the people within the hydroxyurea control group. So individuals who had fetal hemoglobin production, like matched fetal hemoglobin production, but lower white cell counts. It was just, they had less pain and complications for sickle cell. So knowing that, I forget what the point of my dialogue is.
I'm so sorry.
The story of my life. This is why I always interrupt, because I forget. So I apologize.
We was talking about the white cell count and neutrophil, checking the neutrophil levels.
Oh, so with that, thank you so much.
I'm paying attention.
Not you. So this is just the point to monitor. Yes, I'm going to test you guys on all of this afterwards. But that's a lab we want to look into, because we want to make sure that your white cell count is on the lower end of normal. But if your absolute neutrophil count falls below 1,000, some of us have a little bit more of a comfortable threshold, like as low as 750, which is really low too. We might hold the hydroxyurea for a period of time just to let your body recover, and then we'll restart it at a lower dosage. So that's one side of effect too. We know that it is possible, and because of that, everybody on hydroxyurea should be getting labs like at a minimum once a year. I would hope more than that, usually like every 3-4 months. But if you're off hydroxyurea or just not on any treatment, like minimum once a year, you need to get some screening tests done because it's easier to pick up a problem before it actually becomes one. And the other lab that it can interfere with is your liver function tests, your liver enzymes. So that's your AST and your ALT because it's metabolized through your liver. So that's just another value that we're going to look at just to make sure that it's not potentially negatively impacting you. So it doesn't mean it's going to happen. I mean, when you look online, I would say don't go to Dr. Google because it's going to make you think that you're dying tomorrow and just list side effects that would make me not want to take hydroxyurea. But we know the side effects. We know the possible serious ones that it can cause. And as a result, we monitor for it. We get labs done. So again, we can pick up a problem before it actually becomes one and when we're able to address it and have the best outcomes afterwards as well.
If I'm starting and we're going to be monitoring my labs at that time, if I am going to have any of these side effects that you've mentioned, are they likely to start like at the beginning when we're kind of finding the dosage and getting that measurement? Or can they slowly develop, like, you know, say I've been on it for a year and suddenly I go for a test and something's changed? Can it change anytime?
I wish it was just one, but it's something that we just monitor for because I have a patient who's been on the same dose of hydroxyurea since he's transitioned from pediatrics. And just 6 months ago or so, we had to reduce his dosage because he had the bone marrow suppression, restarted it at a lower dosage. And just recently, we now put him back on the full dose that he transitioned to us on. So it can happen at any time. So it doesn't reassure you at all, but that just stresses the importance when it comes to self-advocacy is just staying on top of your lab exams because it's just the easiest way to prevent something from happening.
Okay. I would say, I mean, also, I know we're saying like don't go to Dr. Google. I would also just say like don't also listen to Dr. Jen, even though I'm not a doctor. I am one of these people that when you read the symptoms and then it says, you know, the rarest of the rarest, like in less than, you know, 1,000
You're
or
going to
million
get that
people,
one.
that's the one that I get. So
I feel
with
the
the
same.
hair thinning, the brute, like all of those ones, I remember looking, I was thinking, but these are like the rarest like complications. And also, I think you have to weigh up like vanity over health. Like, you know, there's so many things we can do for hair, nails, skin. We can cover it up. We can do a lot. I think having a better quality of life ultimately is what's more important. So
But as a
if
teenager, it's hard to realize that.
it is. I mean, you couldn't talk to my teenage. You couldn't talk me out of that at that age. But I'm aware now that, you know, there are some things that are more important. If when I stop hydroxy or if I have it and then I suddenly stop, will there be any sudden changes, do you think, that might happen?
You might start getting more crises or more hospitalizations or your hemoglobin might drop. But if you stop the medication, it's not like all of a sudden you're going to feel terrible. It's just, it's hard with hydrea because when you have pain, you take your pain medication, within an hour, you feel a difference. Where with hydroxyurea, you don't really get that instant satisfaction. It's more of when all of a sudden you start to have your first hospitalization or your first crisis, and then you start to think, okay, well, maybe I was doing pretty, like you think about the 6 years you were on hydroxyurea, it sounds like you were doing pretty well, but then you stop it and you don't realize that hydroxyurea is really happening or helping until you had your first episode again. So
Once I start it, how long will it take for my body to kind of see the benefits of it?
yeah, it's definitely something that you got to trust the process because it's not like pain medication. You have to take it for a good 2+ months consistently to really start noticing physical difference and also to start noticing a difference in your labs. For my patients who are missing like 3+ times a week, I basically say we have to figure out a way to make you more consistent with it, or we should just stop it altogether because you're missing too many doses. So it's really important to take it consistently every single day. I always say, like when the patients are in the hospital for whatever reason, they'll do 1 tablet 3 times a day. It's like, no, just take 3 tablets once a day. The more times you have to take your medication, the more likely you are to forget it. I usually recommend taking it at bedtime. So if you have any side effects like GI upset, etc., like the most honestly, the majority of my patients don't have any side effects. If there are some side effects, sometimes they say they have a headache or maybe they get a little GI upset. I tell them take it at bedtime so that way you're sleeping through any of the side effects. But say you forget your bedtime dose, you can still take it the following morning and take that bedtime dose too because you have like over 8+ hours in between that missed dose. But it's something that you really need to take consistently to maximize the benefits and give it at least 2 months to really start noticing a difference in your labs and also how you physically feel. But it could be even longer depending how long it takes to find the right size and or right dose for your size.
Okay, so I'm now 34, going on 35. I have a lot of organ damage. I just know it from having so many episodes of acute chest
You might
to
not.
No, I mean, these are like facts. Like
I'll
I
give you
have
all the
it.
labs. I'll give you the labs to make sure you get checked to see how
These
that
are
is.
facts. So I have like the organ damage. I had iron overload for a very long time, which was mainly on my liver and my heart. Um, Kidneys, I haven't recently had like an increase in protein in my urine. So, but monitoring it, sometimes it goes up and then sometimes it's fine. So it's a bit hit and miss. So I know that I have some sort of this organ damage, and I'm also thinking about the adults with sickle cell that are, we're now living longer, right? I know people that are in their 60s, 70s that have sickle cell. Say they haven't taken hydroxy or they didn't want to take it, and they listen to this fabulous podcast episode, and now they're like, do you know what? I feel like this might be able to give me some quality of life back. Can it improve their quality of life, and can it kind of stop some of the damage that's already there? Like what are the benefits of starting it even later on in life once a lot of the damage has already been done?
I have several patients who started later in life, like in their late 40s, 50s. And honestly, whenever they start, I give myself a little pat on the back and I get really excited because it's never too late. Like, yes, I think everybody would benefit starting earlier because I think the kids who are born with sickle cell now are going to lead such a normal life because we're starting hydroxyurea so early that we're really not seeing a lot of organ damage, et cetera, which is awesome. But there's never a wrong time to start. My most recent patient, she was 52. She was either 52 or 54 and just started hydroxyurea because she felt like her whole life she was doing really well. And it's very hard to convince somebody to take a daily medication that requires monitoring, that has different side effects you're literally never in the hospital. But it got to a point where we started finding protein in her urine that was consistently there. And she was just constantly fatigued. She was very, very tired. It wasn't even the pain that brought her to starting Hydrea. It was just she wanted more energy and she was nervous because she started to see some changes in her labs, and we started at that time. So we can't always reverse the damage. Sometimes you can. Because again, if we put you on a therapy that's protecting your organs, it's possible that we're preventing more insult to injury, that some of it could reverse from just no longer having that sickling effect to it. But I wouldn't want to tell my patients, yeah, start Hydrea and then we're going to reverse everything back, because I like to set realistic expectations, but it should definitely prevent progression once you start that therapy. And I think it's all about mindset, because she was very upset having to start a treatment. Like, we talked about it for years. Like, I'm the type of provider, even though if I think you're going to benefit from a therapy, even if you don't want it, I'm still going to talk about it when we circle back at your next appointment, because people's minds change. Maybe there's new information. So we kept talking about it, and we just kept continuing the status quo. She's very holistic, like you as well. And then one year, she's like, you know what? Like, she was crying to me and just saying, I feel like sickle cell has the best of me. And it's like, I feel like I need hydroxyurea because like I can't keep up. And it made me sad I flipped the narrative. I'm like, this is you taking control of your life, because it's like, you can lead the horse to water, but you can't make him drink. It's like we were leading her, and she finally started, and she's doing so well. Like, her hemoglobin, her baseline was like 7.9, which for her, like, people learn to tolerate low hemoglobins. Like, I had one patient whose baseline was 5.5, and she would get admitted to the hospital with hemoglobin of 3. And every single time I'm just like, how the hell is this woman functioning right now? Like, you learn to tolerate really low hemoglobin thresholds, but then it just gets to a point in your life that, why are you being a hero? Like, you're making yourself work so much harder when we have tools that could potentially make your life a little bit easier for you. So her labs are great. Her hemoglobin are now 9.5, which is awesome. She has so much more energy. She's able to just do what she wants to do. Because again, I think a lot of times you kind of accept your life for what it is, where sometimes if we want to push the boundaries a little bit, you might notice that we can actually be doing better. It's just having the will and the team and just the treatment team to really kind of push you in the right direction. So I don't think there is ever a right or wrong time. I think the earlier is better, but even if you decide later in life to start it, you'll still get some benefit.
I'm so glad to hear you say that, and I think I have to give a shout out to my doctor as well, Dr. Pancham, because I remember having a conversation with her, and she was saying, "Have you thought about hydroxy?" I mean, every appointment, which is sometimes like annual right now, she says, "Have you thought about it?" And I'm like, "I'm fine," and the discussion that we always have is, I'm not saying that you're not okay. I'm just saying you could be doing a lot better. And I think one of the things that we do as people living with sickle cell, we're so good at getting used to how we are, so it becomes the norm. So the chronic pain suddenly becomes so normal that it doesn't even feel like pain because you have it every day. So this is just your
And
normal.
that's not normal. Like it's
Exactly.
like I deal with back pain that it's like I'll have like weeks and weeks and weeks of back pain. I'm like, oh my God, is this my new normal? You start to tolerate it and like figure out how to keep life going. And then all of a sudden the pain goes away. And I'm like, geez, like why was I
Why
getting
was I
stuck in
even doing that? I
that?
don't know
Right?
if it's like pride or ego. I
For
don't know what
sure.
it is. But I think it's definitely something like when you mentioned about your patient, the fatigue and the chronic pain. Like for me, fatigue now, although I'm great and stuff like that, I do notice that. I mean, sometimes I tell myself, oh, I'm getting old. But I think
You're not though.
exactly, I'm not. And we make excuses because, it's kind of like pride, it's kind of like ego, it's kind of like, I'm healthy and I'm doing fine and I'm not going
And you
into
don't want your
hospital.
sickle cell to define you either.
Exactly. So this has been a really interesting conversation, even for me. I feel like, yeah, I will
We'll probably get
definitely.
even more questions, concerns, and misconceptions, etc. after we air this
Oh,
one.
yes,
This
we
is always a
definitely
hot
will.
topic. It's my fave topic too because it's such a great therapy. So
It
I'm
is, but
glad
do
we
you
got
know
to
what?
dive
I'm
deep.
glad we had this conversation. I feel like it's been therapy for me because as much as a lot of the questions that we got, which I've tied into this conversation that we've had from Instagram, I've managed to ask you, and then of course some of my own follow-up questions, just thinking about my life. So dare I say, Miss Bloomberg, that you have swayed this holistic guru to kind of consider her future.
I wish
I
we had a video right now seeing my ecstasy on this side of the screen.
I know. I think my biggest thing was what's the point in starting and stopping, starting and stopping? But, if it's going to make a difference in the case of 2 months and
And
you
if you
can start them.
tolerate it, you're not getting any side effects and you
Yeah,
can keep up with the routine.
why not?
Could be worth it.
Why not?
Love that.
Say no more. This has been an absolutely amazing conversation. I hope the listeners enjoy it. If you have any more follow-up questions, there is a link if you listen on Spotify where you can leave questions about the episode. So please do that. Send Maya DMs, send DMs to the podcast page. And the podcast page is at Sickle Cell Podcast. It still will be. And my Instagram is janika.leah. Maya, yours is?
I'm the Heme NP, HEME NP, like nurse practitioner.
Right, so get in touch with us. I'm sure there'll be follow-ups. I'm sure they may even try and prove you wrong, so we've got to prove them right again. But
Do it.
I am
At
convinced.
least
I think
challenge.
this is amazing. So thank you so much.
Of course.
Take care, guys.
Bye.